I want to speak directly to the more than 10,000 staff who work in our state-operated healthcare facilities. First, I want to say to you, our staff are critical. You provide quality, compassionate care in a 24-hour setting. You fill the department's mission to promote health and wellness every day and serve people during their most fragile moments. And that's just on a normal day. Now, on top of everything else, you are on the front lines of the COVID-19 pandemic, and your work is more important than ever. In the midst of these circumstances, I want to be sure that you are getting information directly from me. It's vital that we have proactive two-way communication and transparency, which, as you know, are core values for the department. With that said, let me dive into a few updates to make sure you have the most latest information. Our behavioral health system and the role our facilities play in that system is especially important right now in three key areas. First, keeping people out of the hospital emergency departments. The emergency department is never a good place for an individual having a behavioral health crisis, and now there is an added risk of exposure to COVID-19. The more people who get sick at the same time, the more likely we will overwhelm our hospital beds and medical supplies. We must keep admissions at our state facilities open and discharging people to the community when appropriate. Second, managing the stress of a pandemic. The uncertainty, fear, and anxiety that come with social distancing, staying home, and feeling isolated increase the need for services and supports for all of us, but especially for our most vulnerable individuals. Your work is critical to promoting wellness in body and mind as North Carolinians deal with the stress and challenges brought on by this pandemic. Third, supporting the people we serve. Many of the nearly 2,500 patients and residents in our facilities are at high risk for this disease. They may have underlying illnesses, have fragile immune systems, or be over the age of 65. Serving this population, keeping them safe, and supporting them is imperative. We know that all of you, every member of our staff at every facility, are committed to this essential work. Therefore, it is vital that we do everything we can to support you. My first priority is to keep you safe. We have aligned our policies and supplemented your leave to encourage you to take care of yourself, as well as our patients and residents during this challenging time. If you're sick because of COVID-19, that absence does not count as an occurrence. Additionally, if you have symptoms, or if you are just screened at work and sent home by management due to the symptoms or possible exposure, you can now use emergency leave, which will not count against your other sick or personal leave. I want to be very clear. If you're sick, please stay home. You will not lose pay. But if you're well, we need you at work. Your coworkers and those we serve are relying on you to be there. To help support that, we've done several things. We've made childcare available to our employees who have lost childcare. We are also moving to increase our staffing so that we have people in place to provide care if employees get sick. And so we can also expand our facilities' capacity to respond to this challenge. We may be called upon to help the state's healthcare system during a potential surge in COVID-19 patients. So we're working to accomplish this now. We are also working within our already tight budget to make emergency premium pay available where possible. In facilities that have an outbreak of patients or residents, we are now able to provide emergency premium pay at time and a quarter for all hours worked by all staff on site. Staff working directly with patients or residents that have tested positive for COVID-19 will receive emergency premium pay at time and a half for the hours they work with them. We have been eager to implement this pay and will continue to find every opportunity to support you with our tight budget. Of course, we are continuing efforts to prevent COVID-19 in our facilities and limit its spread, including universal screening of staff and ongoing monitoring of all residents and patients. We're also providing clear guidance on how to conserve personal protective equipment so that you will have it when you need it most. There is a global shortage of PPE, and we are working every day to increase our supply, as well as doubling down on using PPE correctly so that it's effective. This is an ongoing challenge, but these efforts, coupled with rigorous cleaning and disinfectant procedures, have proven successful in dramatically slowing the spread of the virus. This is a highly contagious virus, and you all have worked diligently to protect patients and residents, as well as your colleagues and yourself. I am very grateful. While we are all truly in this together, you are the ones on the front lines of this pandemic, and we will emerge from these difficult times if we communicate effectively with each other. We want to hear from you, and while we may make mistakes, we commit to trying all we can do to make things better, including listening to your ideas on how we can make improvements. Right now, during this crisis, you are our heroes. Your work is essential. Our patients and our residents need you now more than ever, and I am so incredibly grateful to each and every one of you for all you are doing to meet this immense challenge. Thank you.